From Main Street to Wall Street, it's the topic on everyone's mind these days, the coronavirus.
Yeah, the World Health Organization has declared it a global health emergency. According to the CDC, more than 80,000 people are infected around the world, and there are 53 confirmed cases right here in the United States.
So it's also still flu season, which shares some of the same symptoms. And here with all of what we need to know is NBC News medical contributor, Dr. Natalie Azar. Okay, Dr. Natalie, everybody's talking about it, but we don't have all the information. How contagious is the coronavirus?
It is definitely more contagious than the flu, right? And that's something that all of us feel relatively comfortable with, that you can pass it on from person to person. I think numbers to keep in mind, though, just big perspective check, is not so much about how contagious it is, because that's definitely important, but it's also important to think about how potentially fatal it is. We throw out these numbers that for flu, it's about 0.1% mortality. For coronavirus, it's about 2%. SARS was 10%. Ebola, the average was 50%. And I think that is just something that people need to keep in mind, because we are going to be seeing more cases in the U.S. that are currently tabulated. But for the vast majority of people, it's going to be a mild illness. And of course, the fatality number is not nearly as striking or concerning as some outbreaks we've seen in the past.
A lot of people don't know the difference. Like, I mean, right now, we said there were 50-some odd cases in the United States, but we just saw in Milan that they canceled part of Fashion Week. They ended Carnival, Tom Cruise's movie, they're not shooting it.
Right.
And this is because of what they're calling a cluster. Like, how quickly does this stuff, like, pop up?
Right. Well, I mean, I think it took everybody back a little bit to realize how quickly it was spreading. I mean, at first we were thinking maybe it was spreading on par with SARS, but I think the sheer numbers of it are what are concerning. And it was interesting, a piece that I read just this morning that said, ironically, it's great that it's not so virulent, let's say, as SARS or Ebola was, but could that also be the thing that makes it more dangerous? Because people are having milder cases, like 80% of people, and not know it. And that's the concern, because the big unquestioned answer, or the big unanswered question, is about what's something called asymptomatic transmission, right? Like, can you walk around and have coronavirus and either be really mildly symptomatic and think you have a cold, or be completely asymptomatic and transmit it?
How close are we? I mean, everybody's asking this question. To a vaccine?
Not that close. You know, there's definitely a race to the finish on this one. There's a lot of companies that are vying, you know, to get this done, which is fantastic. And we will probably have what are called vaccine candidates. That merely means that they first are going to test for safety. Think about that can happen in the spring. By the summertime, they can start testing for efficacy. But by the time we get something that's both safe and effective, we're looking at least 12 months, 12 to 18 months.
We hear about people dying of this, and you were describing that, but the way they're quarantining people, and there's like, it seems like a 5-alarm fire everywhere. So if an able-bodied person who wasn't elderly and wasn't a baby were to get this virus, what is the potential outcome? You
know, the expectation for someone who's otherwise relatively healthy and not elderly is that you would treat it the way you would treat a viral syndrome, a mild flu-like illness, or even a cold, with, you know, rest and hydration and things like that. One of the interesting reports that came out of the New England Journal was about the symptoms that people presented with, you know, fever, dry cough, fatigue, and then like 5 days later they developed shortness of breath and later could develop respiratory failure. So I think that's important for people to keep in mind, that if you do feel like you know, if you start feeling sicker at day 5, 6, 7, you know, you got to seek medical attention.
So quickly, to complicate things, it's flu season. What are the difference between the symptoms of flu and coronavirus?
Fever, cough, and shortness of breath can apply to both. I think with flu, we're very accustomed to this idea that it starts really quickly, super stormy onset, a lot of those aches and malaise and things like that. Beyond that, there's really not much to distinguish the two, other than the travel history. Prior to all these other outbreaks, like in Italy and other areas in the Middle East, and even Europe, we were talking about travel to China. I think at this point, it's
traveling
safe
anywhere.
It's safe to provide guidance to say, if you have come into contact with anyone or been to an area where there's an outbreak, you are theoretically, you know, theoretically could have been exposed.
And any international city that has people traveling in from all over the world is another place.
All right. Exactly.
Thank you so much.
It's a very fluid situation, so they're watching every day.
Thank you, Dr. Natalie.